Hi, my name is Payman and I'm a preventive and social medicine specialist and a professor at Tehran University of Medical Sciences. In this channel, I'm gonna summarize a recently published paper from the Lancet journals. And for today, I selected a specific paper. Its author is Eric J. Topol. Do you know Dr. Topol? Of course, he is a brilliant, famous American physician. And firstly, I found him because of his tweets during COVID-19 pandemic. In those days, his tweets were so informative and he predicted greatly some trends of the pandemic, and they were true. First, I thought that he was an epidemiologist. However, after searching, I found that he is a cardiologist and he knows many things about molecular medicine, digital medicine, artificial intelligence, and so on. To be more precise, based on Scopus database, his H-index is 196 and he is one of the top 10 most cited researchers in medicine. Interestingly, he was awarded $207 million in 2016 from the National Institute of Health of the US. Yeah, it's correct. $207 million. Surprisingly, this grant was renewed recently for $282 million. Dr. Topol has 3 bestseller books, and in this article he is going to describe one of them called Deep Medicine. So the title of this paper is Machines and Empathy in Medicine. It was published on October 21st in the Lancet journal in issue number 10,411. Dr. Topol begins with the following sentence. The human bond between patient and clinician is fundamental, but he says that the patient-doctor relationship is affected by physician's limited time. Specifically, after adding some new tasks for physicians. For example, you know that in recent years, all physicians should update their patients' data in electronic files in computers. And in this way, some of the patients think that their physicians don't have any compassion and empathy. Dr. Topol says that in my book, Deep Medicine, which was published in 2019, I released a new theory. I proposed that AIs can repair such relationships by supplying more time for physicians. You know that more time can cause longer time for listening to patients' history, more careful physical examination, reinforcing human communications, increasing the sense of care and compassion, and all of them can be produced by AIs through different ways. First, they can decrease cleric functions because you know that there are multiple cleric functions for physicians, including writing prescriptions, tests, scheduling follow-up visits, and health insurance checks. Second, AIs can screen specific medical conditions like heart arrhythmias, skin lesions, and urinary tract infections. Third, you know that there are a host of new chatbots that they can communicate with patients and they can answer patients' questions. In this way, patients can ask their questions from from AIs, and physicians have more time. AIs can analyze patients' data and project various diagrams and figures about their diseases. AIs can review literature for finding new information about the diseases, new advancement in medicine, and so on. They can provide differential diagnoses for patients, and you know that in the future some of the patients can be monitored in their homes instead of admitting in hospitals. Dr. Topol says that in my book, I didn't anticipate something. I didn't anticipate that AIs could improve physicians' empathy. Of course, you know that there are some new research show that AIs can have better empathetic functions than physicians. However, it's a controversial issue, and some other scientists believe that AIs are not good replacement for physicians. They emphasize that machines' empathy is pseudo-empathy. Of course, it's empathetic in appearance, and AIs cannot truly connect with patients. They concentrate only on words. However, physicians can underscore their empathy using eye contacts, hand movements, and holding their patient's hands. Another shortcoming for AIs is that AIs are not able to answer many specialized and specific questions. In addition, there were some new research that showed that AIs had some mistakes in replying to patients' questions. Of course, we think and we expect that in the future, AI's mistakes can be declined significantly. Many thanks for your attention. If you are interested, please like this video and subscribe to this channel. In this channel, I'm gonna summarize one of the recently published papers from the Lancet journal. Please kindly send your comments. Take care.